Welcome to Brillians training video. Brillians is the new name for the application previously known as SupraVISTA. Today's topic is VA Formulary search with Brillians. Did you ever ask CPRS? Show me all the eardrops in the VA Formulary. Or, show me the diapers and pads in the formulary. Or, show me all the medications that have statin in their name. CPRS is not programmed to do that. In CPRS, the prescriber cannot find an item unless he knows the exact name of the drug. In CPRS, the user must know the drug's exact formulary name. For example, HCTZ/lisinopril finds the drug, but lisinopril/HCTZ does not. The users are expected to remember hundreds of such nuances. Brillians can find medications by their partial names. In the above case, a search for HCTZ will find all the drugs containing the word HCTZ. You can search the formulary for topical eardrops with otic, find all the ARB meds with sartan, and just as easily find diapers, gauze, and the rarely ordered supplies like tracheostomy care kit. Can you give me a real-life example of why do I need formulary search? Okay, suppose you have a new user, for example, a resident, or a new provider, who is not familiar with the VA formulary. She wants to prescribe an angiotensin receptor blocker drug for hypertension. However, in CPRS, she cannot find a drug using the drug names she knows. Normally, she will ask another provider, or call the pharmacy. In the process, she just wasted about 5 minutes. With Brillians, it takes seconds. All the ARB drugs end in sartan, just like all the statin drugs end in statin. In Brillians, user searches for sartan and instantly finds all the ARB drugs. Here is another example. An experienced user does not prescribe certain drug and supplies very often. Today, he needs to prescribe antibiotic eardrop and colostomy supplies. However, in CPRS, he cannot find the drugs using the names he knows. Normally, he will ask another provider, or call the pharmacy. In the process, he just wasted about 5 minutes. With Brillians, it takes seconds. In Brillians, search for otic, and instantly find all the topical ear medications. Then search for Hollister and Colost to instantly find all relevant supplies for colostomy. So, what is in it for me? Here is how every prescriber benefits from the formulary search. 1. Using the formulary search, you can save a lot of time and frustration. 2. You can quickly find all the relevant medications without knowing the exact drug name, especially for combination medications and supplies. 3. For most users, it is a challenge to find and order supplies. Let Brillians help. 4. As shown on a later slide, to reduce keystrokes, you can copy the drug's name from Brillians and paste in the CPRS medication ordering form. This slide shows how to open the formulary search form. On the main form stop panel, click on the Pharmacy button. This opens the formulary search form shown on the next slide. The formulary search form is shown in this slide. In the left pane, it shows list of all the medications in the VA Medical Center's formulary. The user can search the formulary drugs list, using the full, or the partial, names of the items, as shown on the later slides. To search the formulary, do the following. 1. In the search box, enter the filter conditions to filter the medications list. In this case, the user wants to see all the ACE inhibitors using PRIL, and the ARB drugs using the word sartan. 2. Click on the search buttons. The right pane displays drug names which match the search words. Note that you can exclude the non-formulary items by checking the box just above the search box. The user can copy the selected item to paste in CPRS medication ordering form. See the button on the bottom panel pointed by the red callout. It is just as easy to find the infrequently prescribed and hard to find supplies, like diapers, ABD pads, colostomy-related supplies, tracheostomy care-related supplies, and Hollister items. Grandma says, for best results, please follow the following tips. 1. Use the partial names, for example, use syringe, and not insulin syringe, because the item may be listed as syringe, insulin. 2. Think of the possible alternatives, for example, gauze, dressing, bandage. 3. Brillians ignores spaces around user-entered search words. To force a space, use the underscore character, that is, type Shift- next to 0 on top row of the keyboard. 4. Avoid too many search words. It is hard to review results if you end up with scores of matching drug names. Start with a few specific words, then broaden the search, if needed. 5. Experiment. Pretty soon you get hang of it. Once you have found the desired item, you may want to order it in CPRS. To save a few keystrokes, Brillians lets you copy the drug name, which you can paste in CPRS. Note that you cannot order drugs within Brillians. That must be done in CPRS. Do the following in Brillians. 1. Click on the desired item to select it. 2. Click on the Copy to Clipboard button. This button is on the bottom panel. Switch to CPRS and do the following. 1. Open medication ordering form. 2. As shown in the image, right-click in the text box where you enter drug's name. On the menu, click on Paste. Or, use Ctrl-V for paste. As always, the best way to learn a new skill is to play with it. You cannot do any harm to the patient's medical record, or to Brillians, by exploring various features. So, please feel free to click around, open forms, and check out various features. Thank you for taking time to review this presentation. We have many informative presentations on YouTube. Please search YouTube for Brillians Training, or SupraVISTA Medical DSS. If you have any questions, please contact us at help.supravista@gmail.com.